Welcome to the Aced It podcast, where we turn science into sense. This is the 14th season of Aced It, and we are so incredibly grateful that we are able to deliver rich scientific content to you in a usable and understandable way. Aced It is brought to you via the Justice Community Overdose Innovation Network, or JCOIN. If you're new to Aced It, welcome. We're so glad you're here. And check out the prior seasons to begin or continue your learning journey. A special thank you to every wonderful listener. We promise we will continue working to help you learn and grow via Aced It. Also, a quick plug for a few other JCOIN features. Did you know you can get technical assistance for your organization from the experts at JCOIN? And did you know you can apply for a small research grant to help fund an innovative study idea? Yep, through JCOIN. And did you know you can apply to be a JCOIN LEAP scholar or investigator, a year-long mentorship that will improve your skills? Also through, you got it, JCOIN. If any or all of these exciting offerings sound interesting, check out our website, JCOIN-CTC.org, and learn about the many JCOIN courses, products, and opportunities beyond Aced It, all designed to translate science into sense for you. With that, I am honored that you're with us. I'm Danielle Rudes, your host, and this is Aced It. Welcome back. This is season 14, episode 2 of the Aced It podcast, about the stories we tell about drugs and overdose. This season, we're exploring the narratives told about drugs and overdose, who gets to tell them, and the narratives they choose to spread. Ultimately, these narratives shape stigma, guide policy responses, and affect access to treatment. Today, we're going to talk about news media framing. When we think about how people form opinions about drug policy, most of us aren't reading peer-reviewed journal articles. We're reading headlines. We're watching news segments, and we're hearing narratives repeated across news outlets. So, when overdose makes the headlines, whose stories are told? And how? Research suggests it happens in several ways, through which stories receive attention, how people are portrayed, and who gets the opportunity to shape the narrative. Let's get into it. First, let's look at which overdose stories receive the most attention in the news. One study by Dertadian and Rance, 2023, analyzed overdose coverage in 3 major Australian newspapers between 2015 and 2020. They compared how often different types of overdose deaths were reported. What they found was striking. Deaths at music festivals accounted for nearly 70% of overdose news stories, even though far more deaths occurred from injecting drug use or pharmaceutical opioids during the same time period. In other words, the types of overdose deaths receiving the most media attention were not necessarily the ones causing the greatest loss of life. The authors also looked at the emotional tone of the news coverage. Festival overdose stories often included detailed descriptions of the person who died, along with quotes from friends and family expressing their grief and shock. By contrast, deaths related to injecting drug use were more likely to be reported in the aggregate, through statistics or references to broader social problems rather than through individual stories. These differences suggest that media coverage doesn't simply reflect the overdose crisis. It helps construct which deaths become visible and emotionally resonant to the public. Next, let's talk about how media stories can amplify particular narratives, which helps shape public debate. A recent study by McLeod and colleagues, 2024, examined news coverage of safer supply programs in Canada, which, if you remember this episode from last season, means providing people who use drugs with prescribed pharmaceutical alternatives to the unregulated street supply. The goal of this program is to reduce overdose risk. In early 2023, several news outlets published stories suggesting that medications from safer supply programs were being diverted and sold to youth. Some headlines even framed this as the emergence of a, quote, new opioid crisis, unquote, among young people. But when researchers analyzed the coverage, they found that many of these claims relied primarily on anecdotal reports rather than empirical evidence. Once those narratives appeared in a few outlets, though, they were repeated across additional newspapers, editorials, and opinion pieces, a process research described as media amplification. Importantly, when the authors compared these claims to available health data, they found that most youth overdose deaths were linked to illicit fentanyl, not medications used in safer supply programs. The takeaway here is that media narratives can shape public understanding of a policy issue even when the underlying evidence tells a more complex story. Another way the media shapes public perception is through how individuals and communities affected by overdose are portrayed. McGinty and colleagues 2019 analyzed more than 6,000 U.S. news stories about the opioid epidemic and found that nearly half used stigmatizing terms such as, quote, addict or substance abuser, unquote, while only about 2% used person-first language, like, quote, person with a substance use disorder, unquote. As you'll remember from the first episode on this season, studies show that these word choices really matter. Stigmatizing language can increase negative attitudes toward people who use drugs and reduce support for treatment policies. Now, beyond words, visual imagery can also shape public attitudes. Hom and colleagues 2025 conducted a random experiment examining drug-related news photographs, and they found that images of people injecting drugs increase feelings of disgust among viewers. In contrast, though, images of people in recovery increased willingness to work closely with someone with a substance use disorder. Okay, and even beyond that, news coverage can also differ in how individual overdose victims are represented. For example, Johnston, 2020, examined Canadian news coverage of opioid overdose deaths and found that many articles focused on personal stories of young victims from relatively stable backgrounds, often including photographs, interviews with family members, and descriptions of the person's hobbies, goals, and achievements. At the same time, though, Johnston observed that coverage of overdoses affecting other, predominantly minority communities, often appeared more frequently in community-level reporting rather than individual narrative stories. These differences in storytelling may shape how audiences perceive who is most affected by the overdose crisis and how they interpret its causes. Finally, we should talk about who gets to shape the story. Media narratives are not only shaped by journalists. Advocates and community members also use media platforms to influence public understanding of the overdose crisis. One study examined media coverage among the Vancouver Area Network of Drug Users, or VANDU, one of the longest-running drug user advocacy organizations in the world. This study was conducted by Junzagi and Vandu, 2026. In the study, the researchers found that by engaging with journalists, people who use drugs can act as powerful media influencers. Vandu members relied on policy engagement, where they regularly used media coverage to discuss drug policy, especially the importance of harm reduction. In interviews and statements, they emphasized evidence-based strategies such as supervised consumption sites, safe supply programs, and housing support, often drawing on their own lived experience to challenge abstinence-only or forced treatment approaches. They also took part in government lobbying and political engagement. News coverage frequently showed Vandu members participating in policy discussions with local and provincial governments, advocating for decriminalization thresholds, funding for harm reduction programs, and expanded services for people who use drugs. Advocacy on behalf of minority communities was also important. Many stories highlighted Vandu's efforts to raise awareness about homelessness, poverty, and housing inability in Vancouver's downtown east side. Members used the media to draw attention to how issues like evictions, encampment sweeps, and lack of shelter space increased overdose risk. Additionally, when the government responses were slow or insufficient, Vandu members sometimes engaged in civil disobedience, such as operating unsanctioned harm reduction services or distributing tested drugs, to push for policy change and demonstrate alternative approaches. Finally, public demonstrations were another key strategy. Media coverage frequently documented rallies, marches, and memorial events organized by Vandu to draw attention to overdose deaths and advocate for safer drug policies. Similarly, Morris and colleagues' 2021's research on mothers who lost children to overdose shows that many engage with journalists in order to raise awareness and advocate for policy change. Participants in that study described the media as a powerful tool for educating the public and influencing policy debates. At the same time, they also noted the risks, such as sensationalized coverage or stories being simplified in ways that don't fully reflect experiences. Whew, that's a lot today. And with that, we've wrapped up the studies that I wanted to talk with you all about today. Across all of these studies, one message becomes clear. News media doesn't simply report on the overdose crisis. It helps shape the story society tells about it. Through decisions about which stories receive attention, how individuals are portrayed, and whose voices are included in public conversations, media narratives influence how audiences understand drug use and overdose. And those narratives can have very real consequences for public attitudes, policy debates, and the resources directed toward addressing overdose. In other words, the stories the media tells about drugs and overdose are not just descriptions of reality. They help shape how society responds to the crisis itself. Thank you so much for listening to the ASTIT podcast. We love hearing from you, so if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write to me, Danielle Rudes at Sam Houston State University. My email is drudes@shsu.edu. And of course, thank you to the Justice Community Overdose Innovation Network, JCOIN's Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriter team and also my fabulous doctoral students at Sam Houston State University, Bryce Kushmerik-McCune, Jalen Magana, and Alexa Mata. And a huge and a heartfelt thank you to the team at Slonky LLC for their wonderful podcast production as always. Tune in again soon for another episode of ASTIT.